Welcome to Montgomery Heart and Wellness Live, and tonight we're going to talk about heart failure and how this disease can be deadly. However, it doesn't have to be. So I'm going to share some insights with you in terms of how you can learn about the early signs of heart failure. And if you learn these signs, you can avoid it. But first of all, I want to let you know that heart disease is a lethal disease. We should not take this illness lightly. It's never a day that goes by where I do not interface with families and loved ones of individuals suffering from this lethal disease. My heart goes out to any one of you who out there who may suffer from this disease or who may be at risk for this disease. But the facts are simply this. Of individuals aged 20 and older, about 6.7 million of them have heart failure. In the year 2030, that number is expected to go up to 8.5 million. Roughly 1 in 4 individuals are expected to suffer from heart failure in their lifetime. But the good news is that this disease can be prevented. And I want you all to know the early signs so that you have the best chance of preventing this disease. Now, at the end of this presentation, I'm going to share some information with you in terms of how you can reverse this illness. But also, I want you to go to our Heart Strong survey, which is in the notes of this talk, of the notes of this video. And you can take the Heart Strong survey. It will give you insights in terms of how strong your heart is. And there are tips in terms of how to reverse your condition if you find you have significant problems with your heart. So without further ado, let's get into the first symptom, which is one that's very nonspecific. Fatigue. Fatigue is a condition that we often feel. We may be tired because of lots of reasons, lack of sleep. It's a sensation of not feeling well. It's a sensation of feeling drained. There's also mental fog that goes with it. Also difficulty concentrating that can go with fatigue. However, if you cannot exclude one of these other conditions, such as poor sleep or other problems, think of heart failure because it can present early on as symptoms of fatigue. And also it can progress to the point where you cannot perform your activities of daily living. Problem number 2, GI symptoms. This can be very subtle. It can start off as a loss of appetite. It can be something as subtle as indigestion. It could be feeling of bloatedness, belching, constipation or diarrhea. And you can also have nausea or vomiting. These symptoms of GI upset can be very subtle symptoms of heart failure. And the reason for this is that as the heart starts to weaken, it starts to give circulation to parts of the GI tract such that this circulation to the GI tract is compromised because circulation is preserved for the brain, the heart itself. And so areas such as the GI tract may lack circulation, so the GI tract may malfunction. The next symptom is frequent coughing. Many individuals relate coughing to asthma or just sinus drainage, but coughing can be dry. You can have a productive cough. It could be puke sputum. Sometimes people bring up blood tint sputum with heart failure. Severe coughing spells that interrupt your sleep is also a very prominent symptom of heart failure. And if the coughing gets worse when you lay flat, that points directly to early signs of heart failure. And you should get yourself checked out if you're starting to have these symptoms. And of course, it often gets worse with physical exertion, which again is a sign similar to shortness of breath, but coughing can be present instead of shortness of breath, and it can worsen with laying flat or physical exertion. Breathlessness or windedness. Now, it may start off with the inability to simply complete a sentence or have a conversation. So if you're talking to a friend on the telephone, oftentimes a friend or a loved one may notice it before you do. They notice you can't complete sentences, or you have a hard time with controlling your words because you just get out of breath. You have to stop and you have to gasp. Sometimes you get short of breath with mild exertion. So just simply climbing a flight of stairs or simply carrying groceries or something like that. And of course, shortness of breath with lying flat is a very common sign of heart failure, especially when it wakes you up from your sleep. This is a very common symptom of heart failure that results in severe episodes of gasping in the middle of the night that interrupts your sleep. And we see this very commonly in people as heart failure symptoms progress. The next symptom is swelling. Lower extremity swelling can be in your ankles and your feet. Frequently, it may start in the feet as mild swelling. It may have a sensation of tightness when you wear footwear or socks. Your socks may feel a little bit tighter than normal. You may also have the appearance of puffiness in the feet and ankles very early on. And of course, swelling in the ankles that worsens with activity is a telltale early sign of heart failure, as well as persistent swelling throughout the day. Again, a sign of heart failure. So if you start to have these symptoms that can progress over time, be alert to these symptoms, get yourself evaluated, and see a physician, because at this point, heart failure can be reversed. It can be reversed with simple lifestyle changes, not just medications and surgeries. So I want each and every one of you to learn about your heart strength. Go to the notes in this session and find the MHW Heart Strong quiz. The link is here, and the link is also in the notes. Take that quiz. It'll give you a score. It'll give you insight as to what condition your heart may be in. Pass it on to loved ones or anyone you know who may benefit from this. And of course, if you take this quiz, we give you lots of tips in terms of how you can naturally reverse any symptoms or early conditions of heart failure that you have. So I hope you find this helpful. And of course, until next time, I want you to take care. If you're new to the station, I want you to subscribe, like, and share. And of course, if you've been here before, give us a thumbs up and share this with anyone who can benefit from this information. Heart failure is a potentially deadly killer disease, and I want all of you to be safe from it. Until next time, take care.